PDO threads are sterile suture that is placed in the face or the body for laxity and rejuvenation, stimulation of collagen. PDO thread would be the generalized category, and then there are several different brands. Novathread are the brand that we decided to carry as they're produced in the United States and they are FDA approved. So it actually goes under the skin. What we would do is we would make a small incision and numb the area where the threads are to be placed. That would be if we want to do some lifting in the mid or lower face. Sometimes the threads, we don't even need an injectable. Maybe we could just do a topical lidocaine. We'll often place threads like in the borders of the lips, or we'll place it in areas where we need collagen and elastin stimulation. So Botox is placed in different areas. So Botox does not lift, Botox paralyzes. So when we're looking at especially lower face laxity or where we have areas that need more definition, Botox doesn't treat those areas. This may have been an area where we used to use more dermal fillers. The pendulum always shifts, and I would say patients in some areas were starting to look very overfull, and so I think that there's a lot of hesitancy to receive dermal fillers, which is one of the reasons the PDO threads really started becoming in vogue very quickly and really took off in the aesthetic market. It's a completely different mechanism of action. So instead of restoring volume in the face, we're kind of lifting and we're applying a thread that has a hook on the end. So we are lifting and then the threads are tied off and then they're cut and they stay in place. So we're lifting in those areas. They start to relax after a certain amount of time, but it is, they're completely different procedures and completely different methodologies in how they're treating an area. For a patient who is concerned about being too full from dermal fillers, or maybe they have had a bad experience with dermal fillers in the past, or they're looking at something that maybe is a little more natural, the PDO threads may be a good option for them. So you want to make sure that you're trained well, and this is something that the provider, practitioner, hopefully licensed nurse, licensed physician, because this is a very specific layer that we're placing in the patient, it's imperative that you have someone who's well trained. I've seen patients who have come to us in follow-up who had PDO threads placed to where they came out inside their mouth, or they were placed inappropriately and they had severe pain. So this is one of those procedures that it's like everything else. You want to make sure you go to someone who's well trained, and I would recommend a physician-owned and operated med spa like Plaza Aesthetics and Wellness.